When you're starting on insulin, you might be started on a mixed insulin or a single insulin, and it can be in an insulin pen or it may be a vial and syringe. So today we're going to go over the vial and syringe. So your insulin will come in a vial. If it's unopened, you want to keep that in the refrigerator. Once you start to use it, then you can keep it at room temperature. But if your room gets a little warm, over 86, then I would definitely keep it in the refrigerator. If you're going to be traveling with your vial, then you do want to keep it in a cool pack, but not with the ice directly on the insulin. So it's time to give your insulin injection. You would always check your blood sugar first, then you get your insulin ready. Always wash your hands. Soap and water is the best. If you don't have that, you can use like a gel to wash it. And then you want to take your insulin vial and always clean off the top of your vial before you put the syringe in. Then with the same alcohol wipe, usually you can wipe off your stomach area. This is a pillow just because I'm not going to stick myself in my stomach today, but you would wipe off an area. Remember, when you're giving insulin, you want to give it in your stomach area, avoiding your belly button. Pretend there's a bagel there and avoid that area here. And anything outside of that area, you can give your insulin. It goes in fat, not muscle. There are other sites for insulin, but the stomach area is the best. And if you're starting to give insulin, you want to start with that one. All right, so clean off the top of the insulin vial. And then what you're going to do is if it's a mixed insulin, you'll roll it and turn it and roll it. Because the mixed insulin has two kinds of insulins, and you want both kinds to be thoroughly mixed, but you can't shake it because that would put a lot of bubbles in it and that would mess up you pulling up the insulin. So you want to roll it gently 10 times. Once you've done that 10 times, it's usually mixed thoroughly. And then you take your syringe and take off the cap from the bottom, the cap from the top. And then you just look up how many units you're supposed to take given from what your doctor recommended. So let's say I'm taking 15. What I do is pull up 15 units on the syringe, pulling air into it. What that does is now I'm going to put the air into the bottle, and that's going to help me get insulin out without so many air bubbles. So when I put air into the syringe and push it, then you're going to turn it upside down, and then you would pull down the bottom of the syringe down to the 15 mark. You want to double check it. Make sure there's no bubbles. All right? And it's the top of the syringe, the little black stopper that you're checking for. So that's the 15 mark. Then you give your insulin, your stomach area that you cleaned, or my pretend stomach that I cleaned. There's two ways you can give it. You can go straight in, and just go straight in and then push. Some people like to pinch, feel like it hurts a little bit less. Pinch the fat, then go in. If you're going to pinch first, though, you have to let go of the pinch before you push the stopper in. Otherwise, you'll be blocking the insulin from going in. So you go in straight, softly, quickly, not hard, don't jab it. Then you want to push the plunger down all the way and then leave it in. Usually with any kind of insulin, I still say count to 10. Sometimes they do it very quickly, but if you count, you're making sure all of the insulin soaks in. 7 and 8 and 9 and 10. Take it out. When you're finished, you just recap the top, and you want to throw it away in a thick plastic container. It doesn't have to be a Sharps container. If you have a Sharps container, you can use that, but you have to dispose of that properly. Otherwise, an old bleach bottle or an old detergent bottle, you can just put these syringes in there, and then when that's filled, you would just put the top on that and throw that in the trash, not the recycling, in the trash. When you're filling up your syringe with insulin, some people have a hard time seeing the small markings on the syringe. If you have any eye issues, or if it's dark and you just have trouble with these tiny little lines. Another part that may be difficult is holding the bottle up and filling the syringe at the same time. So there is syringe magnifier. And what I like about this is you just pop the insulin bottle into the magnifier. Then when you pull your insulin dose up of air, and then you put it into the bottle that was already cleaned, and push the air in. And now when I'm pulling down to get my dose, be able to see the magnifier there. Also, it's holding the bottle, so if you have any dexterity problems, it's holding the bottle for you, so it's a little bit easier. And you can see the numbers way easier on this. So that's a lot easier for people to see. So you can buy these at a pharmacy or online. They're about $10. Very helpful.